Glaucoma is a range of conditions in which the pressure in the eye goes up in the eyeball, and that can cause progressive sight loss. It's quite subtle because it isn't sort of obvious in the middle of the eye, it's peripheral vision. So it can be insidious and gradual and people don't actually realise, and they can actually fail the DVLA eye tests without realising it got that bad. And so it's really important that we actually diagnose and, more importantly, actually manage that condition to make sure we monitor it systematically and consistently so that patients' pressure is kept under control and, of course, their vision is preserved. So the Ivan is mobile, so it will be coming to East Suffolk locations that are going to be convenient to patients, certainly closer than the hospital. It has disabled access, so there's both a ramp and a lift at the back of the lorry to make access easy. And the receptionist it's important that she gives a questionnaire to the patient so we can get all the details of both their medical and glaucoma history. And importantly, an audit list. This is really a bit of paper that tells the service how the patient has experienced it. So it's both a qualitative thing, how much they've enjoyed it, any problems, any comments they've had, because we're monitoring the clinical outcomes separately. But it's so important that we know how the patient found the experience. We really do need the Ivan because the population with glaucoma is going up as it gets older, you see. And so we need a way where we can monitor systematically and consistently all the patients with glaucoma. And carrying on as we are in a busy hospital department is just not going to work because the numbers are getting unmanageable. So we need a way where we can do the job properly and consistently and give a really good service to people closer to their homes. So after this, the patient comes in and has their visual acuity test, which is the same as doing the eye chart at the optician. Importantly, then go on the visual fields machine, and this is an expensive piece of equipment that detects whether the visual fields are deteriorating at all. Little dots come up and the patient presses a clicker so they can say if they can actually see that dot. And this is really sensitive and a very important test for managing glaucoma. Well, the hospital is a busy unit full of experts, and what we have to do is to make sure that the right patients are seen by these experts. Now with glaucoma, maybe 80% of these patients are quite stable and just need to be monitored and check that everything is all right. So with the Ivan, we can get all the parameters, all the tests emailed to the consultant expert to make sure that everything is stable. So those patients don't need to go to the hospital. Going to the hospital is quite a problem as well because it takes a lot of time. When you're there, it's quite involved, whereas this way we can look at just one condition and manage it as efficiently and effectively as possible. So in the next stage, the patient is led through to another part of the Ivan where they can meet the optometrist. He is explaining exactly what's going to happen next. So this is explaining how the machines work, what they're doing, and also about the application of the drops to numb the eye so that the eye pressure can be measured accurately. And first of all, he measures the pressure of the eye using a machine that just sits on the top of the eye, having been numbed. And after the pressure's been taken, he has a good look at the back of the eye to see exactly how it is. The next stage, the patient goes in front of the retinal camera and the optometrist captures a high quality digital image of the patient's back of the eye. It's so important that we have this and that we can compare it with previous images so we can detect any changes as they happen, should they happen. So at the end of the process, the patient is told when they can expect their next routine appointment, and also that if there's any changes made after the consultant has reviewed all the investigations, that they will hear about possibly a change in drop treatment or an early appointment at the hospital if it's required. It's really important to understand that patients themselves don't initiate appointments. We're working closely with the hospital to identify the group of patients with chronic stable glaucoma who are suited for this type of intervention. It's so important that we actually use the hospital for what they're best at, their expertise, and try and keep the chronic care that can be looked after perfectly well close to people's home out of the hospital. This is an example of primary care, which is GPs and the clinical commissioning group, working closely with the hospital, which is secondary care, to make sure the right people go to the hospital to make it efficient use of that resource, but most importantly, give the best care for patients wherever they are.